in gynecology these days. So today's topic, I'll be discussing about a very sensitive topic, and there is very much great concern of this topic because it is sometimes very much the pregnant expecting ladies, they become very much worried. So actually, this today's video I'll be discussing about that is about the early pregnancy bleeding. So early pregnancy bleeding, it is most commonly, it's not that very common, but the thing is that whenever an expecting mother, whenever a pregnant mother, if she is expecting and it has been confirmed through the pregnancy test that she has conceived, and during a couple of months or during the first 3 months of pregnancies of her, during the first 3 months, the first trimester of her pregnancy, she might experience certain kind of a bleeding, and this become very scariest, and she is really condition where the woman, the expecting mother, becomes very much in uh, stressed and troubled, just because if it is a slight bleeding and a red spot or any kind of a spotting or bleeding if she's observing in her undergarments. So this early pregnancy bleeding, it has nothing to worry about, and depending upon the amount of bleeding and depending upon the how long the bleeding is persisting, this has to be taken into consideration, whether it is to be worried about, whether it is a serious issue or not. So basically, let us understand why this early pregnancy bleeding is there. It is actually called as the implantation bleeding. Now whenever the egg is going to be fertilized with the sperm, so the fertilization is going to take place in the ampullary isthmic junction, that is in the fallopian tube somewhere. It is the egg is getting fertilized, and from there the fertilization, if it has taken place, slowly and gradually the zygote and the subsequent stages of zygote, morula, blastula, and finally when it comes into the uterus, the this blastula, it gets implanted into the uterine wall. So once this embryo is going to get implanted into the uterine wall, this is ultimately going to cause certain small amount of a bleeding can be there, which can be called as implantation bleeding. So there is nothing to worry about, and this the incidence of this kind of a bleeding is it's not that very common. It is seen that in this first trimester bleeding is found in, mostly if there we are considering 100 pregnant women, it will be found in at least 15 to 25 women who are out of 100 pregnancies. 15 to 25 women will complain of this early pregnancy bleeding. Now this early pregnancy bleeding can be little bit, it can be a light, in the form of a light spotting, or it can be a very light bleeding, and it can occur 1 to 2 weeks after the fertilization has taken place, and once the fertilized eggs gets implanted into the lining of the uterus. So this kind of a bleeding is most commonly seen. Now, apart from this, there is certain kind of a, during implantation, it has also been seen that the neck of the uterus, which is called as the cervix. So this cervix is richly supplied during at the time of the implantation during pregnancy. This cervix becomes more vascular, that it has got a very rich blood supply, and more number of blood vessels are developing during this time. So cervix may also bleed during early pregnancy, and just because there are more number of blood vessels developing in this area during this early trimester, the early pregnancy, that is the first trimester. However, if this bleeding, it is common during the first trimester or the first 3 months, that is the first 12 weeks of pregnancy, the slight bleeding is nothing to worry about. It has nothing to be of great concern. And the symptoms what the expecting mother, they might feel that actually, just despite have not having the adequate amount of knowledge, if their pregnancy has been confirmed and if they're experiencing a light spotting or a light bleeding, they can observe, so they mostly get becomes very scared, just because they don't have the idea, they don't have that knowledge of implantation bleeding. So however, during the first 3 months or the 12 weeks, is it can be seen that a slight spotting or light bleeding can be seen. But when about looking at the symptoms of it, so at that time what the expecting mother is going to have symptoms, so that symptom during that slight bleeding, it can be seen in the form of certain kind of nauseating feeling, mild cramping of the uh, abdomen can be seen. Apart from little bit of lower back pain also, the expecting mother can complain of, and she might confuse it with that she is having the actual, the cramping and the bleeding of a period, but it's not actually the period. This expecting mother, what the symptoms what she is facing, just like feeling nauseating little bit, feeling the mood swings, and apart from this, little bit of lower abdominal cramping as well as a back pain, she might confuse that this is all apart, alongside with bleeding, this can all be the symptom of her regular periods, but it is not so, and it is nothing to worry about. But you need to be very cautious about the time duration. If a light spotting or a light bleeding is there, it's okay, fine. But and this bleeding, the timing of the bleeding should be very importantly considered. Implantation bleeding is going to happen just for a sake of few hours, or it can maximum persist in the form of light bleeding or spotting up to a maximum of 3 days. So this is the maximum time duration, and it can range from a light bleeding or a pink spotting or a bright red bleeding, and it may last from a day within a few hours to maximum of 3 days, and may be accompanied by little bit of cramping or backache. So implantation bleeding, as I've already said, the time duration is very, very important to be considered, because it is going to happen for only a couple of hours to full 3 days it can happen. But you need to be extra cautious about it, and you need to immediately inform your healthcare professional, healthcare providers, for if you are having the period of bleeding more than 3 days. So then it becomes a matter of concern. If the bleeding, once the pregnancy has been confirmed, if the bleeding is bright red or dark red in color, lasts for more than 3 days, and that too the bleeding is in full flow, which is going to fill up your pads or the tampoons, so it is usually, it is very unlikely that it is not the implantation bleeding. So you should be be very cautious about the timing. As I've already said, the implantation bleeding can occur for a couple of hours up to a maximum of 3 days. That too a very light bleeding or a very light spotting, it can be there, but it is never in a full flow. However, if the bleeding is continuing in a full flow, and that too if it is persistent up till the greater than 3 days, so it's actually a matter of great concern, and you must immediately contact your healthcare professional for the proper treatment, and you should get this condition assessed and examined by yourselves. So this was a very short video. I have tried my level best to simplify that what is the early pregnancy bleeding, what is implantation bleeding, and how should you differentiate from the regular menstrual bleeding to the implantation bleeding. All right, if you still have any queries and comments, you are most welcome to comment me in the comment section. And if you like this video, give this video a thumbs up. Students and viewers who are new to my channel, if you like this channel, if you subscribe my channel, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.